This is a brief summary of the preliminary report of a program evaluation of the Ask Workshop, conducted by an independent program evaluation consultant. This evaluation study is ongoing, and a more detailed report will be available later in 2022. The Ask Workshop was developed to fill a knowledge gap in the area of suicide prevention. This is important since suicide is a leading cause of death for children between the ages of 5 and 15 years of age. Contrary to widely held beliefs, children's immature understanding of death may increase their suicide risk. Suicide risk in childhood is correlated with increased suicide risk in teens and adults. So although death by suicide may be rare in very young children, identifying and providing appropriate support to children with suicide thoughts may be an important way to prevent suicide among older children and teens. And because children are developmentally different from adults and adolescents, it may not be suitable to apply suicide helping techniques developed for adults and teens to children. For these reasons, more research into child suicide is needed, and there is a need to enhance available training for potential helpers to address the unique circumstances of children at risk of suicide. Training community members as suicide prevention gatekeepers is now an important part of broader suicide prevention efforts. Gatekeeper training aims to increase the likelihood of gatekeepers successfully identifying and interacting with at-risk individuals. Gatekeeper training focuses on increasing perceived knowledge of warning signs, risk factors, and protective factors, enhancing skills related to suicide prevention, changing attitudes and beliefs about suicide to ultimately increase self-efficacy of gatekeepers, and to enhance acquisition and application of new behaviors aimed at identifying at-risk persons, engaging them, and making appropriate referrals for suicide-specific help. There is some evidence that broad implementation of gatekeeper training may increase likelihood of identification of at-risk individuals and referral for suicide-specific help, thereby potentially preventing suicide acts. Ultimately, the hoped-for outcome is prevention of suicides through the actions of large numbers of trained gatekeepers. The Ask Workshop is a gatekeeper training that is available in face-to-face and online formats. Both formats are highly interactive trainings that include discussion, guided simulations, practice, and application of what is learned to case studies. Both involve around 8+ hours of direct, live, facilitated, interactive learning. The ideal participant is a professional helper who works with children, such as child and youth workers. While there are similarities between the Ask Workshop and other gatekeeper trainings, there are also some important differences. The Ask Workshop is longer than most gatekeeper trainings, which are typically only 1 to 4 hours long. The focus of the Ask Workshop is specifically identifying and engaging with children at risk of suicide. Another difference is that the Ask Workshop provides more in-depth exploration of risk and protective factors than most other gatekeeper training programs, directly referencing empirical studies. And unlike other gatekeeping programs, the Ask Workshop seeks to enhance participant understanding of the at-risk child through various lenses: the lens of the family, the community, and the lens of the child themselves. An important part of the Ask Workshop is enhancing participants' awareness of formal and informal resources within their local community. The importance of collaboration between caregivers is reinforced by the design of the workshop's learning processes that put participants together with almost every other participant in case discussions and simulations, working in small groups. This also contributes to development of expanded helper networks within and across work settings. The logic model that you see here is a research-informed visual representation of the changes or outcomes that are expected to be achieved through participation in the Ask Workshop. These outcomes are informed by the existing literature on suicide-specific gatekeeper training programs. Because each participant or organization is unique, their learning journeys will differ. Some outcomes may be achieved earlier and some later than depicted in the logic model graphic. Interconnections exist between intended outcomes of the Ask workshop. For example, all the immediate outcomes are connected to each other. These connections are evident in the findings of this program evaluation. There are also cross-connections between outcomes that point to either interdependencies or enabling outcomes. For example, in the medium and long term, the organizational level outcomes are depicted as enablers for other outcomes. The findings of this preliminary evaluation are aligned to the immediate outcomes of the logic model. In this presentation, we'll look at what the results of this evaluation study tell us about how the Ask workshop meets the immediate desired outcomes. The purpose of the evaluation study was twofold: to determine the effectiveness of the Ask workshop in achieving the immediate outcomes identified in the logic model, and to inform a more comprehensive program evaluation to be conducted in 2022. The data presented here are derived from 2 pilots run from October to December of 2020 and February to July of 2021. In total, data from more than 800 participants at the Ask workshop online were analyzed for purposes of this evaluation. The majority of participants included in this study were located in the United Kingdom and Canada. While participants represented virtually all backgrounds and all walks of life, most identified their roles as child and youth workers, social workers, teachers, including school administrators, and a mixed group of people who described themselves as predominantly providing mental health or emotional support and/or suicide prevention work in their communities. Outcome 1 speaks to understanding the issue of suicide among children. In Pilot 1, 94% of participants self-reported an increase in knowledge about the relationship between a child's understanding of death and suicide risk as a result of their participation in the Ask workshop. This finding is also connected to Outcome 2, knowledge of suicide risk for children ages 5 to 15. The survey findings in Pilot 2 pointed to a marked increase in participants' knowledge related to the prevalence of suicide in children ages 5 to 15, how children attempt suicide, and the relationship between a child's understanding of death and suicide risk as a result of their participation in the Ask workshop. There were numerous comments on this and the open-ended qualitative questions included at the end of the surveys. Outcome 2 in the logic model is increased knowledge of risk and protective factors for child suicide. This slide shows that in Pilot 1, 92.9% of participants self-reported an increase in their knowledge of things that could increase a child's risk of suicide. In addition, 90.9% of participants self-reported an increase in their knowledge of things that could protect a child from suicide. The findings were very similar in Pilot 2. This slide shows the significant increase of participants reporting they knew a lot about protective factors for children after the workshop as compared to before. The open-ended questions at the end of the surveys captured many comments about the acquisition of Outcome 2. Outcome 3 is heavily connected to Outcome 2 and speaks to increased preparedness to detect signs of psychological distress that may be warning signs for suicide. In Pilot 1, 90.5% of participants self-reported an increase in their knowledge of the warning signs that a child might be at risk of suicide. In Pilot 2, at baseline, 11.9% reported they knew a lot about warning flags for suicide in children ages 5 to 15. On completion of the workshop, 95.5% of participants reported that they knew a lot about warning flags for suicide in children ages 5 to 15. And there were numerous spontaneous comments about this in the open-ended survey questions. Outcome 4 speaks to how likely these helpers were to engage in conversations about suicide directly with children. In Pilot 1, 94.9% of participants self-reported an increase in their knowledge of how to ask a child about suicide as a result of their participation in the Ask workshop. In Pilot 2, shown here, there was a significant increase from baseline in participants' self-reported comfort level in asking a child about their understanding of death and asking a child directly about suicide. There was also an increase from baseline in their knowledge of how to ask children about suicide in a developmentally appropriate way. And their responses to the open-ended questions spoke to their feelings of greater comfort and confidence to have those direct suicide-related conversations as a result of participating in the Ask workshop. In Pilot 2, we gathered data about the nature of interactions participants had with children in the 3 months prior to the workshop. Almost 1/5 of participants indicated that they had suspected or been concerned about the possibility that a child they had recently interacted with might be at risk of suicide, but that they had not approached the child to explore this possibility. This suggests that there were a significant number of missed opportunities to potentially identify a child at risk of suicide. As you've just seen, participants completing the Ask workshop tell us they feel more comfortable and confident about having a conversation about suicide with a child. In the next phase of the evaluation study, we hope to gather information to help us determine whether there is a reduction in the number of missed opportunities after attendance at the Ask workshop. Outcome 5 is about increased knowledge of the actions to take to support a child at risk of suicide. This outcome is strongly connected to Outcome 7, enhanced skills to implement actions to support children at risk of suicide. In Pilot 1, 94.4% of participants said that their knowledge of how to do a brief screen for suicide increased as a result of their participation in the Ask workshop. 90.4% of participants self-reported an increase in their knowledge of how to talk to parents about their child's risk for suicide. In Pilot 2, there was a marked increase in the number of participants who felt they knew a lot about helping actions that are prescribed by risk factors versus warning flags, how to do a brief suicide screen with children ages 5 to 15, how to create suicide-safe environments for children, and how to talk to parents about their child's risk for suicide. These were compared with the number who felt they knew a lot about these things at the start of the workshop. And there were a number of unsolicited comments in the open-ended questions reflecting participants' feelings of having learned a lot about specific actions to take to support children at risk of suicide. Outcome 6 speaks to awareness of the formal and informal helping resources that could be utilized to help mitigate suicide risk for a child. This outcome is strongly connected to Outcome 2, knowledge of protective factors for children, and Outcome 7, enhanced skills to implement actions to support children at risk of suicide. In Pilot 2, there was a marked increase in participants' knowledge of research-based recommendations for when to refer a child for suicide intervention help, as well as an increase in participants' knowledge of formal and informal helping resources within their communities. Participants at the Ask workshop receive and practice using specific tools to help them provide support and access support for children at risk of suicide, and participants commented on this in their responses to the open-ended questions. They also noted that the collaboration between and among participants was in itself a useful resource, and that their network was expanded by virtue of coming together and working together at the workshop. Outcome 7 is strongly connected to Outcome 5, knowledge of actions to support children at risk of suicide, and number 6, awareness of formal and informal resources for children at risk of suicide. In both pilots, participants reported an increase in knowledge of how to conduct a brief suicide screen for suicide risk in children and how to talk to parents about their child's risk for suicide. In Pilot 2, participants also reported an increase in their knowledge of how to create suicide-safe environments for children and recommendations for when to refer a child for suicide intervention help. The previous slides showed the specific survey items related to this outcome. Again, their open comments on the surveys reflect their feelings of being better equipped to take the actions needed to support children at risk of suicide after participating in the Ask workshop. Participants were also asked to indicate their overall satisfaction with the workshop along 3 dimensions. How relevant is the workshop to your work with children? How useful were the content, tools, and resources provided at the workshop? And would you recommend the Ask workshop to a colleague? The majority of participants rated the Ask workshop as highly relevant to their work. Most said they were very likely to use at least one thing they learned at the Ask workshop in their work with children. And most participants said they were very likely to recommend the Ask workshop to a colleague. We asked questions about how professional they found the facilitation team, how knowledgeable the facilitators were, and we wanted to know if they felt the workshop was delivered well and if they felt all the moving parts were managed well. The majority of participants gave high marks on all these indicators. Based on this preliminary evaluation, the conclusion is that the Ask workshop has been highly successful in achieving the immediate outcomes outlined in the logic model. Participant feedback indicates that the learning outcomes related to knowledge and skills acquisition were enhanced by high-quality facilitation, high level of interaction between participants and facilitators, and practical application of knowledge through exercises such as simulations and case studies. There's also some evidence that medium-term outcomes of increased confidence and increased self-efficacy have also been met. A more comprehensive program evaluation is planned for 2022. This will employ a mixed methods approach and will attempt to assess the extent to which the Ask workshop is successful in achieving longer-term outcomes that are outlined in the logic model.